In an instant, it can steal your words, seize your movement, and change your life forever. Today, we're going to be talking about stroke. We have a panel from the Reading Hospital Comprehensive Stroke Center to provide us with some information. Once seen as a disease of the elderly, stroke is now affecting people of all ages. In fact, it's the 5th leading cause of death in the United States. But there is some good news. According to the CDC, upwards of 80% of strokes are preventable. So today we're going to talk about some ways to avoid strokes, what to do if you think you're at risk, what to do if you think you're having a stroke, and what your recovery might look like. So I'd like to go ahead and introduce our panel from the Reading Hospital Comprehensive Stroke Center. I'll start at the end with Dr. Riit.
I'm Dr. Brennan Riit. I'm an endovascular neurosurgeon here at Reading Hospital, and I'm co-director of the Reading Hospital Stroke Center.
I'm Dr. Shahin Manoocheri, and I'm also an endovascular neurosurgeon. I've been here for about 6 years at the Reading Hospital and also co-director of the stroke program.
And I'm Jody Kilpatrick, a certified registered nurse practitioner who works in the outpatient clinic at the Reading Hospital Stroke Center.
I'm Dr. Goswami. I'm one of the vascular neurologists here at Reading Hospital, and I've been here for about 5 years at Reading Hospital.
Great. Let's start with you, Dr. Goswami. What does a stroke specialist do?
Sure. So a stroke specialist pretty much is a doctor that you would see if you come in with any sort of stroke symptoms. In the hospital, we manage acute strokes, and what that really means is that when people are having real-time, real symptoms, we triage them in an expedited manner. They're brought into the emergency room where they usually meet us and our team. We're pretty much on call in the hospital 24 hours, and we rapidly evaluate our patients, get the appropriate imaging that we need to get to diagnose the stroke, or them having any sort of, and strokes has obviously multiple meanings. The loose term is stroke, but it can be ischemic, which is typically lack of blood flow to the brain, or it can be hemorrhagic, which is a bleed in the brain, or something that people call a brain hemorrhage. And that's triaged emergently with a team of doctors, and we pretty much intervene on that in the time around it, pretty much after the stroke actually happens, the first 24 to 48 hours.
Great. And Jody, you work with the stroke specialists and the patients.
Correct.
Tell us about that role.
I work in the outpatient setting, doing the stroke follow-ups once the patients are discharged from the hospital. When they leave the hospital and go to the post-acute rehab at the Reading Hospital, I also follow up there. It helps with the transition of care, make sure appropriate testing is completed, follow through with any testing results, ensure they're on appropriate medication, follow up some of their secondary stroke prevention, their risk factors, and help them through their recovery.
And so, Dr. Goswami, you talked about a brain bleed, and I think some people in the old days would maybe call it a brain attack and stroke and these very big terms, but tell us basically, what is a stroke?
It's a great question. So, I think some people think stroke is a heart attack, but it's not. It affects the brain. And it used to be called a brain attack before because they wanted to draw a parallel as into what happens with the heart, and the same thing that happens to the brain. So you pretty much have lack of blood flow to the brain for any reason. Either it's a clogged artery or it's a bleed, which pretty much results in the function of the brain to stop, which results in the symptoms that people have. An interesting fact about strokes, especially ischemic strokes, which is where we talk about lack of blood flow to the brain has no pain receptors. So typically people don't actually have any pain. But the function of the brain, for example, if you're having a stroke that affects your right side of the body, you get paralyzed on the right side of the body. And that's kind of the only symptom you get from a stroke. So sometimes people don't take it that seriously because the symptoms don't bother them enough. They think they can sleep it off, it can get better, and usually it doesn't, but they present late because of these reasons. So that is what an ischemic stroke is lack of blood flow to the brain.
And how does a stroke affect someone?
So one of obviously the most serious symptoms that it causes is usually paralysis, difficulty with speaking. It can affect people's speech. It can make them mute. And that's the disability factor of stroke is usually the most dangerous part of a stroke.
And what are the warning signs? So you mentioned a lot of people put it off, but what are the things that people should really be alert for?
So we have an acronym for that, and I think we have a slide for that. We like to use an acronym called BFAST, and the acronym pretty much stands for B for balance. So if you have any difficulty with your balance, you feel like your gait is off, you feel like you're not walking appropriately. E for eyes, you can either have lack of vision of the eyes, loss of vision of the eyes, or even double vision. Face, if your face just doesn't look the same, usually we say uneven face or asymmetrical face, a face droop. Your arms, if they're getting weak, your legs are getting weak, that's the A. Your speech is affected. So either it's slurred or you're not able to talk or understand people. So anything to do with the speech function. And the T is for the time, which is, you have to get emergent care right away and call 911.
If people think they're having a stroke, should they take an aspirin?
That's a great question. No, they should not. In the field, at home, they should not. They should wait until they come to the hospital. We evaluate them, because in the immediate moment of the stroke, you don't know if this is a bleed or ischemic stroke, which is a lack of blood flow to the brain. And if it's a bleed, the aspirin is obviously not going to suit well.
And what about people who are, maybe older adults who feel some of these symptoms often with other conditions or other medications? What would be a sign for them that they need to act? So
we have a lot of stroke mimics, which means that you can have stroke-like symptoms that can occur in the setting of, something else. The brain is actually a very sensitive organ, so it does react to other things happening in the body. So you can have stroke-like symptoms, even though it's not a real stroke. But typically, the concerning things about stroke is always that when the symptoms are immediate, they occur suddenly, not so much in a progressive course. That is usually a sign for you to seek help. And when I say seek help, I mean in the hospital, not so much your family doctor or something like that, because the care there can be delayed.
And I know that at the hospital there's a real set protocol for this. So what's going to happen when you arrive and you say, I think I'm having a stroke? So
when the ambulance actually comes in, even prior to them making an entry into the hospital, they alert us. So the doctors are pretty much all on standby. We rush the patient to head imaging to make sure that there's no bleed. And if there's no bleed, there is medications, and these are life-saving medications. They're FDA approved. We call them clot-busting medications that we can give patients if they qualify to break up the clot. The outcomes of people that take this medication are favorable. Usually within 3 months after taking these medications, most people actually return to their baseline. That's what the data has shown. We can only give this medication, though, within the first 4.5 hours. So time is of the essence. So that's why it's important that they be fast. Absolutely. So Jody, talking about what leads up to this stroke, what are things that people can do to prevent a stroke?
Well, healthy lifestyle is very important. 80% of the strokes are preventive, as you said previously, by controlling blood pressure. For prevention of stroke, we're looking at less than 120/80. For secondary stroke prevention, it's less than 130/80. Diet is very important. Mediterranean diet is a very good diet to follow. Lots of fish and chicken, vegetables, fruits, low saturated fats. Okay. Avoiding beef and pork, minimal as much as, as minimal as you can. Controlling your blood sugars. If you're diabetic, keeping your blood sugars under control. Compliance with the medications are very important. Your cholesterol. Cholesterol is very genetic as well as diet controlled. So with family history of cholesterol, following up with your family doctor regularly and taking medications as prescribed. Activity is important. Exercising 30 minutes a day, vigorous, moderate exercise daily. Walking is very good. Intermediate pace, speed, slow down, as long as you're physically able to do that. Avoiding heavy alcohol use. No smoking, no street drugs, very important. Lots of water, plenty of water, 6 to 8 cups of water a day, and appropriate sleep. So what if, someone watching this show is an older adult and, they haven't really lived a very healthy lifestyle. They haven't followed this. We've all had our fried foods and our alcohol and all that other good stuff. Is it too late? Not necessarily. You can't turn back the clock, but you can change your lifestyle to prevent future problems. Some of the medications, they lower cholesterol, but if you think about the cholesterol medicine, they help stabilize the plaque inside those vessels, decrease inflammation. So you can stop the damage from progressing by medication and following up in that change of lifestyle.
Great, and I know you talked a little bit about foods, but can you talk a little bit more about that when you say Mediterranean diet?
Mediterranean diet is low in fat, high protein, lots of legumes like black beans, garbanzo beans. Your white meats, chicken with no skin, the breast is better than your thigh. Your fish is good. Don't fry your food. Use olive oil. Butter, saturated fats, and you want little to no saturated fat in your diet. Butter, coconut oil is actually a saturated fat. Anything?
No,
That's
that's
pretty
about
much it. For the
And then what are things that you can't control?
atrial fibrillation. You know, that can happen with age. Alcohol can increase the risk of atrial fibrillation, although aging also increases that risk. So managing it through your medication, following up with a cardiologist.
So Dr. Manoocheri, if someone has one of these factors, do they just wait, or what conversations can they have with their doctor? What things can they do to either figure out if they're at risk or mitigate the risk?
Well, that's where seeing your primary care doctor frequently can really help, because they're going to be experts at catching different aspects about your family medical history, your personal medical history, and monitoring your cholesterol levels, making sure they're keeping you accountable about maintaining a healthy lifestyle, a healthy diet. And so sometimes just getting started with taking care of yourself and changing the way you care about your health life is to find a good primary care doctor.
And earlier, Dr. Goswami mentioned arteries, but I think he's not talking about the arteries we think of in our heart, right?
Mm-hmm.
So what is he talking about there?
So the arteries in the heart that everyone thinks about with a heart attack are called the coronary arteries. Mm-hmm. But arteries take blood from the heart to all over the body, all the organs of the body. And in this case, we're talking about the brain. And so there's multiple main arteries that provide blood flow to the brain. And in an ischemic stroke, what happens is a blood clot usually gets caught within the artery and can block blood flow to a certain portion of the brain. Sometimes the entire one side of your brain. And when that happens, that makes it so that the brain is starving for oxygen and, like Dr. Goswami mentioned, can't function the way it needs to. Luckily, the body is miraculous and can try to find ways to get blood to that portion of the brain that's starving for oxygen, but that doesn't last forever, and that's why time is of the essence. We say time is brain. You lose billions of neurons of brain for every minute that there's lack of oxygen.
And Dr. Riit, if I've had one stroke, can I have another stroke?
Absolutely. In fact, if you've had one stroke in the past, you're more likely to have a second stroke in the future. And that's why it's so important to follow through with recommendations for what we call secondary stroke prevention, which are the things that Jody was talking about, to make sure that your other medical risk factors are as optimized as possible.
And will that second stroke, will that look like the first stroke?
It sometimes can, but sometimes it can be an entirely different kind of stroke or in a different area of the brain and have different symptoms and manifestations.
And so, Jody, we've talked about once you've been through the hospital, you've had a stroke. What does that recovery look like?
The recovery is different for everyone. It depends where the stroke is in the brain. Some strokes leave paralysis, weakness on one side, loss of speech. Others, you can have cognitive changes, short-term memory loss, depression, changes in personality, loss of impulsivity, or you become impulsive, loss of control. Stroke recovery includes therapy, physical therapy, occupational therapy, speech therapy following the hospitalization to hopefully build up new pathways to gain some of your function back. but it is a lifestyle. It does change life that day.
And I think we have a clip of Lauren to share her story as a survivor.
My first day of the journey was getting him to realize he was having a stroke and get to the hospital for care. And there was Dr. Gay there to save his life and restore his mobility. And so thankful to Tower Health and Dr. Gay for him being at the hospital and helping him. I was there all the time. I was making sure he was getting what he needed, which was provided. And so they released him to me. I took him home, and it was just getting situated. Everybody needs that extra push and somebody behind them being a cheerleader. As a caregiver, listen to your loved one. Read their body language. Try and understand the needs that they have and try to anticipate them. And probably the biggest thing is have patience, because it will take time. The stroke happens like that, but recovery is slow.
Great. I think that's a great message there about patience and also knowing your loved ones and being able to be an advocate for them. And I think we've heard a lot of stories about people who are having strokes who don't realize it or aren't able to express it. And so us needing to really be on the lookout for that. So for a family like we just saw there, what resources are available?
There's quite a few resources out there for us. The Reading Hospital has its own resources. There's a slide for Life After Stroke support group. There's an aphasia support group and a caregiver support group at the Reading Hospital Rehab Center. We also, there's a weight management support group. Obesity affecting, increases your risk of stroke as well. There is a phone number to contact on the bottom of the screen that you can get to find out the dates and times of these support groups. In addition, there's also other resources online for tobacco cessation. The American Heart Association has multiple resources on their website for stroke survivors, for caregivers of stroke patients.
Great, and you mentioned some of these groups, and I think one that's really interesting is the caregiver support group. So why is that important?
Well, caregivers need a lot of support in caring for somebody in stroke recovery. If you have a loved one and they come home a very different person due to memory loss, they're having trouble recalling how to operate the microwave. They can't get their shoes on. The caregiver support group provides resources and ideas for the caregivers and support, emotional support for those caregivers to really keep going and providing care for the loved ones at home.
And I know you mentioned an aphasia support group, and I think that term may not be familiar to a lot of people.
Aphasia is loss of speech. There's different types of aphasia. Some patients can't express themselves. It's called expressive aphasia. And a lot does come with that. They can't express themselves. They can't read. They can't write. And then there's the others that also can't receive the information you're giving to them. So when you're speaking to someone, they're not processing what you're saying. They're not understanding it. You could ask them to hand them a spoon, and they will know to eat with that spoon. But if you don't hand them the spoon and say, could you please act like you're eating your soup, they won't know what to do because they don't understand the language. So that helps with those patients on learning how to express themselves in different ways and to manage it.
Wonderful. And I know there's also an app specifically for patients and caregivers.
There is. It's called the Heart and Stroke Helper app. You can download this from the American Heart Association. And it helps you keep in line with the healthy lifestyle. It helps you monitor saturated fats, activities, keep track of blood pressures, and it'll keep you in line for the healthy lifestyle to help prevent a recurring stroke.
Terrific. Dr. Riit, last September, Reading Hospital received a certification as a comprehensive stroke center from the Joint Commission. Can you tell us what that means?
Right. What that designation signifies about our center is that we provide the highest level of stroke care available. It's a very difficult designation to achieve. There's only about 200 or so stroke centers in the entire country that have this designation. We're one of 12 here in Pennsylvania. And it means that we can treat all different types of stroke, including the blocked blood vessel or the ischemic variety, or also the bleeding strokes in the brain that are often caused by brain aneurysms. It also means that we meet certain volume requirements, because we know that stroke centers that treat a large number of patients tend to have better outcomes. And then finally, we meet very rigorous quality and safety standards that are tracked by the hospital certifying organization that are very difficult to achieve. It took us many years to even get to the position where we were able to apply and be candidates for this designation. And the formal process from application to when we actually received it took about a year. So it's a very rigorous evaluation, and signifies that we really can provide that comprehensive level of care to any patient.
That's terrific. So, you know, this show is all across Berks County, and so people may live closer to other hospitals. So if they think they're having a stroke, how do they decide where they should go?
Well, we, as a comprehensive center, partner with local first responder agencies to work on pre-hospital triage and transport protocols. So many of the agencies here in Berks County we work very close with, and they automatically bring you to Reading Hospital. But it is something that you can also request. I should also add that we are the only comprehensive center between the city of Philadelphia and the Harrisburg area. So within that very wide geographic range, we receive patients not only from Berks County, but outside the county as well.
Oh, terrific. And Dr. Manoocheri, what do you think is one of the most important takeaways from what we've talked about today?
I think that, you know, stroke can happen to anyone. It's not just a disease of the elderly, and not to downplay it. You know, it's not something like Dr. Goswami mentioned. Some people say you'll sleep it off or it'll get better, but like I mentioned, time is brain, and time is of the essence. So seek help as soon as possible so that you can get back to your life as safely and quickly as possible.
And if someone does have a stroke, you know, I know we talked about getting medication quickly. If they get to a stroke center quickly, what can they expect as far as a return to their normal selves?
Well, it depends on how effective that medication is, or if they need any kind of subsequent procedure. One procedure that Dr. Riit and I provide is called a mechanical thrombectomy. So if that medication is unsuccessful, or if it's a large blood clot plugging up a large blood vessel, then we would do a procedure much like the procedure they do for heart attacks when they place a stent. But instead of placing a stent, we go and try to remove that blood clot to restore blood flow to that part of the brain that's starved for oxygen. And that procedure has been shown with very, very, very good evidence and strong research over more than a decade now that it has changed many lives and gotten you back to what we say your pre-hospital lifestyle.
Great. And Jody, one thought that you would have kind of wrapping up today's discussion.
If you think you're having a stroke and you're not sure, still seek immediate medical attention, because time is brain, and there's so many resources available, and if you wait, your option for returning to baseline is less. Just seek medical attention immediately.
I think it feels like maybe that's our mantra today,
Yeah.
right? I know that a lot of people worry about ambulance costs or inconveniencing family, or, you know, what if I'm just having a panic attack, right? But go to the hospital and let them figure it out.
Go to the hospital and let us figure it out.
In the long run, it's worth it.
It's worth
Yep.
it. Yeah.
I'll add to that point. The treatments we do have are just so time sensitive. We're talking about hours, you know, not days, hours. And once we're past that window, we can't give those treatments. And so that's why we keep emphasizing how important it is, time is brain, to seek attention immediately. If you feel like you're having one of those symptoms, to call 911 and get attention.
And Dr. Goswami, I'm going to come to you last and ask you if there's anything other than time is brain that you think people should take away from today's discussion.
So, like what everybody said, just resonating that, right? I think 80% of the work, unfortunately, falls on the patient to come to the hospital. Like that is 80% of the work. We kind of finish the last 20%, which has helped them. So it's so important for the community to recognize strokes, even if it's not within them, someone else like your grandmother, your aunt, your uncle, and identifying the symptoms and not taking them lightly. And like you said, people are not excited to go to the ER and wait for hours. What if this is nothing? But let the doctors and us figure out if it's real or not.
Great, great. I want to thank all of you coming today. I know you have very busy schedules. I know you may be on call. That's how important and time sensitive this is, but I think this has been a great conversation talking about not only does this affect the aging, but people of all age groups. So thank you for joining us today. We have one last slide, which I think kind of wraps up what we said. There we go. So thank you for joining us today. I'm Kate Catchmark with the Berks County Area Agency on Aging for Aging Matters.